Welcome back to Insight. As promised, Aging and In-Home Services of Northeast Indiana is here. We are talking to Mary and Beth. What information are we talking about today?
Well, we're going to talk about our family caregiver program, and we started to talk about that last time we were here to visit with you. And we're going to talk about, in particular, caregiving to folks with dementia. And we picked that topic because if you remember, we talked about our annual meeting is coming up November 2nd, and our special speaker for that is Marcia Gay Harden, and she's a caregiver to her mom with Alzheimer's.
I remember us talking about that, and she has that book that has come out, and it's so cool that you're going to have her. She's a big name.
Thank you. And it always helps caregivers and the cause of caregiving if we bring in a big name.
Sure.
That most people don't identify themselves as a caregiver. I'm just the daughter, I'm just helping out. But when you have a celebrity say, oh wait, it just occurred to me, I'm a caregiver, and there's a whole lot of stress built into being a caregiver, particularly when you're a caregiver to someone with dementia, or in her case, to someone with Alzheimer's.
Well, you say Alzheimer's and dementia. Can we use those interchangeably? Are they the same thing?
Well, oftentimes people use them interchangeably, but if we were professionals, we wouldn't.
Yes.
That dementia is like an umbrella term that 1 out of 7 older adults age 65 and older have dementia. That the greater majority of them, 2/3 to 75%, have Alzheimer's because it is the most common form of dementia. Certainly, dementia, Alzheimer's has one thing in common, which is memory loss. However, memory loss occurs for a lot of reasons. So if you're saying, oh my gosh, where are my keys? Doesn't mean you have either of those two. Okay, that could be you have a medication mismanagement issue. It could be a disease, effect of a current or past disease that are affecting you. So it's not always.
So what are some of the challenges of caring for people with dementia, Beth?
Absolutely. So in Marcia Gay Harden's book, she talks about some of those minor things that people forget, like Mary had mentioned. You lose your keys, or maybe you're supposed to be somewhere, but you don't exactly remember where. And she especially remembers one of the heartbreaking moments. One of her challenges was when her mother forgot who she was, which I know a lot of people experiences. And what we focus on at Aging and In-Home Services is helping those caregivers deal with specific challenges. I know one of the slides that was just displayed showed some of those characteristic behaviors that caregivers deal with. You see these, some of them are very common, agitation, confusion, wandering, etc. Some maybe not so common, but we help caregivers to focus in on whatever behaviors their care recipients experiencing, and then we help to talk with them about how to best deal with them. And we help to educate them to know that those behaviors are a way of communication. People with memory loss don't always know the best way or don't know the words to use. So behaviors can be their way of expressing what they need.
It's almost like we come full circle. When we were toddlers, when we were little children, we threw temper tantrums because we didn't know, we were frustrated or we were in pain or we didn't know how to express ourselves, and that's how we got it out. And it's almost like you swing back to that again because they just want to express what they're feeling and they just can't get it out.
They can't talk anymore. That is so true. You have nailed it right there.
So it's just heartbreaking. It is heartbreaking when it's somebody that you love and you're just trying to help them. So we're going to talk more about the family caregiver and the support groups and all that they do at Aging and In-Home Services. So you're going to want to stick around. We'll be right back.